Good morning, family. Thought we'd bring you in with something new. Ode to My Daddy, The In Crowd by Ramsey
All
Lewis.
right, and I'm in
That's
with
it.
the in
You're in
crowd.
with the In Crowd. Yes, you are.
In crowd's right here.
Yes, welcome to the In Crowd. This is us. This is for your health and you, brought to you by the Medical College of Wisconsin Cancer Center. I am Deb Nevels, your host, one of your hosts for this morning. I am flanked by none other than the notorious Dr. Kevin
All
Izzard.
right. The notorious KDI.
Oh gosh, is that what we doing? Lord, it's too early.
It is
It's
too early.
too early. And of course, my brother, my big brother,
Good morning.
Mr. Bethay. Yes.
Good morning.
Good morning. Good morning.
You might not know, but Bethany and I have a history.
Yes.
When I was way back, when I was still training as a resident,
Oh,
I met Bethany.
nice.
And he was a troublemaker back then.
Oh,
A troublemaker.
A troublemaker.
I was an educator. I wasn't a troublemaker. I was trying to teach
No, you
everybody
were-
what I knew.
you
I
were,
know,
you
but
were. I
probably
remember-
advocating and shaking up
Oh, yeah.
things. And,
Oh, I was truly shaking.
He
See,
was.
there
He
we go.
was. They had a meeting and said they want everybody to dress professionally. They said no earrings. And you remember what you did?
No, what?
You came in.
With the nose pin?
You sure did.
Oh, only our Bethay. Only our Bethay. Of
Yes,
course he
that
would.
was me. That was me.
That was you. That was you. Well, we are so glad to have both of y'all here today because this is something November is a month that is set aside. This actually started back in Australia. Can you believe that? Of all places. It's a worldwide movement that we're doing. That's
The
being
old seats,
done.
eh?
Yes.
Yeah.
Oh my goodness. You do accents too.
I do accents. Bullshit on the Bobby.
Oh Lord. We gonna forgive us. Forgive us.
Oh yeah.
Look, he cannot have
I got
coffee in
I
the
got a
morning.
face for the radio.
No.
That last one sounded like you cussed, man. So be
I
careful. with that.
know. Thank you. Get me in trouble. So we are talking about men's health. November is what we call Movember. The Mo part, the MO part was added because men are encouraged to grow mustaches, to recognize, to bring attention to the importance around men's health. And this was something, like I said, it started way back in Australia and now it's become a global movement. But today we're going to put the flair on it that we always do, bringing the importance of taking action and prevention. And my guests here today can add to the importance. We are also taking it to another level because the importance for us today is fathers, sons, and brothers talk prostate health.
Mm.
So we are looking for, because the one thing we always say, secrets kill.
Oh, that's right. That's right.
Secrets kill. So we got to have those conversations. Got to have those conversations.
That's very true.
Mhm.
That's very true. A lot of us don't talk about, especially men. We don't talk about our health. Maybe we might talk about it at the barber shop, but how many times do you, like women? They got this thing. Your breast exam buddies. You're supposed to call them once a month
Your
and say,
bosom buddy.
make
yeah.
sure make your bosom buddy. Make sure you're doing your breast exams. But we don't have an equivalent for that for guys. You know what I'm saying? Maybe at your prostate check.
Well, that would be something that most men definitely would want to talk about.
Right.
Because in those great days when there was some conversation, if you said the word prostate, they would hold a finger up to you.
That's right.
Be like,
Yeah.
nope.
Not
Yes.
that finger to say no.
Okay.
That would be
That
the
was the
finger
one I
that
was
said
saying.
they're going to do that exam.
Again,
That would be that finger.
Oh, that finger. Oh,
Yeah.
yes. That is, yes.
You know, there's good news in that, right?
Yes, sir.
Yeah.
Yeah.
So the good news is
What's
this.
the good news?
The
Tell
good
us.
news is so when I ask guys about, do you want to get the prostate exam or the check for prostate cancer, first thing they think of is what? The finger.
The finger.
And it's the violation, as they call it.
Yeah, yeah.
And so so we've known for a long time that doing the rectal exam does not add a lot more into making that diagnosis, because if you have prostate cancer, your PSA level is going to be elevated. The PSA is a blood test. It's easy to do. Most of the time when you're going in the doctor's office anywhere, they're going to draw some blood. So you just add another tube onto what they're drawing. So that part is easy. It's that rectal exam that guys don't like. Well, we've known it doesn't add a whole lot more. So they actually officially made the recommendation to stop routinely screening guys with a digital rectal exam. So you do not have to get the finger anymore to get screened for prostate cancer.
The routine about the finger is, I'm glad it's gone. but the doctor did have to do for me personally, I just want to let you know as a disclaimer that anything that I say about prostate health is how and when I went through it with my own personal story.
Right.
So my doctor actually did do the rectal exam because he said he wanted to feel to see how bad it was with the lumps, if there were lumps instead of being smooth tissue.
Right.
So I had to take the deep breath and say, okay, but just don't go too far. You're not looking for
Yeah.
anything else.
Right. I'm glad you said that because I'm glad you said it because it doesn't mean you won't necessarily get one. So if it is abnormal, the urologist probably will first thing do is a rectal exam because you do want to know where that cancer is, and it might make a difference. In most cases, you're going to get an ultrasound or an MRI looking for where the cancer is anyway, but they probably will do a rectal exam if it's elevated. Yeah, and then again, and this is a new recommendation that's happened this past year. And so, if you were screened for prostate cancer before that, there's a good chance that you might have had the rectal exam.
Yeah, and one of the things to note is we talk about the importance of oh no, she's gonna take my sorry the importance of knowing when your loved ones were diagnosed. And this is why we're talking about that conversation with fathers and sons.
Yep.
Okay.
That conversation with fathers and sons.
Yeah, because if you have a first degree relative, and that's first degree meaning father. If your father had prostate cancer, you got a brother have prostate cancer. The closer they are related to you, the more likely it is that you have picked up a gene or some other genetic predisposition for prostate cancer. A lot of people don't realize this. We know about BRCA gene, for women for breast cancer and ovarian cancer. Well, that BRCA gene also in the men will increase your risk for prostate cancer.
But I would like to ask a question about, I guess it's family history. My mom died from breast, throat, and chest cancer. My dad died from GI cancer. And one of my brothers died from brain cancer. And so I just didn't have any kind of love for the C word, period. And it made me afraid. And when I was diagnosed, I didn't have insurance. So for me, I had to wait 5 years.
Oh, wow.
Before I can actually be treated. And he did, of course, monitor that PSA.
Yeah.
But what I was saying is that you mentioned about family, and I was just trying to find out from you that that kind of family history, would that be one of the things that may have contributed to me getting the prostate cancer?
Maybe or maybe not. It depends on what caused it, because those are 3 different kinds of cancer. Now, a lot of times people will say, like you said, your mom, she had breast, lung, and chest. It might have been one cancer that metastasized, and so it may not necessarily be 3 different kinds of cancers. The primary might have been lung cancer and it spread, or it might have been breast cancer and spread to the bone, or so. A lot of times, we think of cancers being in places, but that's the reason why they do a biopsy, because they want to identify what is a primary cancer, where did it start before it spread. And again, those cancers you talk about are 3 different cancers. Good thing is they're cancers that we can screen for, So as far as colon cancer, definitely, you should be screened for that at age 45. We start finding that people who were getting screened for the first time at 50, which was the original recommendation, that we're finding a lot more people have polyps at that first exam. And so it takes about 10 years for a polyp to turn into a cancer. So we figure that if we start screening early, we might catch some of those polyps earlier before they become cancerous. So yeah, get your prostate cancer or get your colon cancer screening, colorectal cancer, men and women. Prostate cancer, that wouldn't affect your mom, but that's in your family now. Prostate cancer. If you're a smoker, then also talk to your doctor about getting lung cancer screening. That's one that's been underutilized. A lot of people don't realize that anything that the U.S. Preventive Services Task Force, it's an organization that of different doctors that make recommendations about screening tests. And so up to this point, any recommendations made by the U.S. Preventive Services Task Force was mandated to be covered by the insurance companies. So, for instance, when you get a colonoscopy, it's an expensive test, but you don't get billed anything for it because you're the Affordable Care Act mandates that they have to cover those screening tests. So mammograms, colonoscopies, your Pap smear, your PSA blood test, all that stuff is covered by your insurance. So don't worry about about it not being about you having to pay something or even a copay. You don't have a copay for any of that stuff.
That's very good information, but you, from what I can understand, did not tap into the true question. And the question for me was there a correlation with my mom, my brother, and my dad having cancer, and the possibility that my cancer was because it was in my family?
So did
that
you
was
risk,
what I
risk
risk.
Well, you know what? A good answer to this is when you have a family history like that, ask your doctor about getting genetic testing. Doing it, you can be referred to a geneticist, and they can look at your history, and there's blood tests you can do to see if you have a mutation that makes you prone to having those cancers.
Okay, well, now you got to the answer, and I appreciate that.
You're welcome. You're welcome.
That's sometimes the biggest issue is that we don't know that family history.
Right.
But as a primary care doctor, is it you when we come in the room for an appointment, if we have that information,
Right.
that gives you so much more to work with.
Right. And family histories can be complicated because like for instance, we assume when someone comes in, you got a nuclear family. We ask about your father, we ask about your brother, we ask about your sister, we ask about your mother. We're assuming you all are the same family. Well, I start asking some of my patients about their family history, and they got a couple of half siblings, and and then they got some kids that may not be known, and so family history can sometimes be complicated.
It's also a secret. In my day, I was born in 1949, so the whole thing about young ladies getting pregnant was altogether different. If I can tell, the short part of the story is my mother lived on one side of the tracks and my dad lived on the other side of the tracks, and she was nice and sexy and he was good and smart, but his good and smart wanted her, nice and sexy. And so they got together. But what I found out was he was not my biological. I went through that with him for years, and all of a sudden, there it was that she finally tells me no. So that was a secret kept. So if I try to follow all the things about him and what was in his life, it wouldn't have had any relevance to me. But that was a secret that was kept. And Deborah, you spoke about family secrets, and that was one that I had to live through.
Yeah, and it's not only the family secrets. I think of myself. I was adopted. So
were you really?
Yeah.
All these years I didn't even know that.
Yeah. Not all these years. Did you have to put the emphasis on all?
We went to middle school together. We went to Webster long ago.
Did they have middle school way back then?
You know what? You know what, Mr. Bethany? I got you. It's fine. I got you. But yeah, and that
we were all in one room.
I know, all in one room. Thank you. But that's one of the things when the doctor asked me my family history. I just focused on my mom and dad, the people who raised me, as I refer mom and dad.
Right.
And then I had Dr. Wayman Parker. It was kind of like, Deb, I thought you said you were adopted. I was like, yeah. And he was like, so none of this makes any difference. And I was like, oh yeah, that part. But it's one of those things, as we grow up. I grew up not even, thinking it made much never mind, because my family never made a big deal about it. We were family. That was my mama, that was my daddy, this is my sister, that was
with me
it.
as well.
Yep. And so it wasn't any difference. But then when I started to get into healthcare, I was like, you know what? I really, and luckily Dr. Parker was like, so we're gonna get baseline of everything. I was like 30, I think, and he was like, you're getting a mammogram, and he made sure that all of that I had baseline information. But like you said, we keep those secrets and we don't talk about it. And especially when you talk about relationships with fathers and sons, that can be really, really difficult.
Yeah. And then another problem too we run into is that we have a lot of fathers that die early, and it may be things like homicide. So that leaves a big gap, and I don't know what he would have had, but he died. He was 25.
Yeah.
So
it's
challenging. Go ahead.
Yeah, it's challenging. As we look at, as I said, in November, and family, please feel free to call in. That phone number to call in is 414-444-5253 or 414-444-5250. as we look at some of the things that we should have conversations about when we think about the um, concerns that we have specifically focused on men's health, heart disease,
Mm-hmm.
cancers. We're talking is kind of our focus, but
Mm-hmm.
in cancer, we're talking about prostate, lung, and colorectal, diabetes,
Mm-hmm.
high blood pressure,
Mm-hmm.
depression, and suicide. That mental health
Yep.
component.
Yep.
Obesity. I can say the words obesity and inactivity.
Yeah.
And
And you know what?
hmm,
And this is sad, but for young men,
oh,
uh, 15 to 25, leading cause of death is what? Homicide.
Yes,
yes,
yeah.
Yeah.
yes.
So even that is a big health issue for
Mhm,
for a segment of our population. So asking things like do you have access to guns, and what's your
yeah,
life like? Who do you hang around with? Those
yeah.
are things that have an impact on your health as much as who your family is.
Is some of the homicide because of some mental health issues, like the anxiety
Right.
that young men go through, and they
Mhm,
can't stand another guy to say
Yeah.
anything because now it's questioning their manhood,
Right.
and it's
Right.
like, let me go ahead and get this over with.
Yeah,
mhm,
and you make a good point because there is a lot of evidence that shows that, like we talked about this on the show before, but they call them ACEs, adverse childhood events. So things that happen to your life that later on go to affect you as an adult. Things like,
mhm,
did you grow up with two parents, the two parent family? Did you were you ever abused when you were a kid? Were you ever homeless? Did you have food insecurity? Anyone in your house ever go to jail? Those things, they can add those things up, and they can predict your risk, your health risks. In
mhm,
fact, they have 10 of those questions. If you get a score of, I'm sorry, there's 20 of them, and if you get a score of 10 or above, your chance of dying is 20 years younger than the average person. So those things, they do affect your health. And when you ask about does mental health affect those things, I'm sure it does. So the trauma a lot of people are dealing with makes them more prone to acting out. And then little things like the police officer and the guy who pistol whipped them, and because they had a car issue about merging their cars. And he gets out, he takes his gun, pistol whips the off-duty police officer. No, he's off-duty police officer. Police officer takes his gun and shoots him.
mhm.
Now, it was justified because he had the other guy
The
had the
gun.
gun, but had they not had guns, then this thing would have been a stupid yelling match. They would have
Okay.
got out. He
Yeah.
would have yelled at the one guy. The guy would have yelled back at them to get in the car and drive off. Or if only one had a gun, if he got out, pistol whipped the guy, but the other guy didn't have a gun, he would have said, held his hand up and said, "Oh yeah," cursed him and driven off. But because they both had guns, somebody ended up dead. And so these access to guns, along with the people's short tempers
Mhm,
and and the trauma that people are dealing with, and the people being triggered, that's why we get this big issue that we got.
One question that I would like to ask, because it's kind of prevalent in my family, uh, that we get a chance to see mom and dad, or mom and her boyfriend, or baby's daddy arguing and fighting.
Yeah.
So we see that it's something normal. And
mhm,
now we are in our teens and we get a girlfriend or a boyfriend, and she or he says something, you want to slap her because mama got slapped by dad.
mhm,
And then you get out in the street and you get somebody else, like a woman, who wants to talk, and you still thinking you the man of the men,
Mm-hmm.
and she says something to you, so you want to pop her.
Mm-hmm.
So do you think sometimes that it's from I guess it's called nurturing,
mhm.
that
Yeah.
you're seeing it in
Environment.
the
Yeah.
home, and you
Mhm.
believe that it's normal?
Yeah. I Believe it or not, I believe that some of that stuff is inherited. So you say people say you just like your daddy. Well,
Mhm.
there is something to that, and we
Mhm,
find that even people who are adopted,
mhm,
that you go back and look at their family history, and you'll find that like siblings will meet each other for the first time, and they realize their personalities are similar.
mhm,
And
mhm.
so you do
Definitely.
inherit some of that stuff.
Mhm,
Um, and so maybe that being having a short temper is something that you inherited. What you got to do though is you got to realize that, okay, this is an issue that I have, and you got to learn how to deal with it.
right.
Okay,
You know,
okay.
and
Right.
so and that's always a problem, is that you have to have a certain amount of self awareness and the willingness and the ability to make those changes. And
Mhm,
sometimes it means you gotta, you might have to go into therapy or do something where you kind of deal with those issues.
Yep.
you got a messed up background, and so yeah, okay, I'm gonna pass that on. You say hurt people hurt people.
Yeah.
Yeah,
You
yeah,
know, if you don't deal with that hurt, you're gonna start hurting other people around you, and you learn behaviors like, that wouldn't be genetic, but you learn behaviors like you said. Dad used to slap mom around. Well, that's how you learn how to treat women.
yeah. Okay.
And that's part of we want to, like we say, some things get normalized,
Hmm.
but we want to focus, we want to be able to normalize being healthy
Right.
and making the conversations around seeking mental health, seeking, going, recognizing that, okay, I need to talk to somebody because I'm so frustrated or I feel anxious all the time. I need to go and talk to somebody. Part of what we also press is that normalizing getting going to a doctor.
Hmm.
We don't, that's something many times if I followed what my mama did, I wouldn't go to the doctor until something was really wrong,
Hmm.
really, really wrong. And that is part of the issue. And on the other side, we're going to take a quick break. On the other side, we're going to talk a little bit about normalizing those preventative practices, those things that can really make a difference in the midst of everything else. You're with Your Health and You, brought to you by the Medical College of Wisconsin Cancer Center. We'll see you on the other side. Good morning. Good morning. Good morning. Milwaukee family, you are with your health and you, and I am so blessed to be in a room. Now, usually, it can be Jermaine and Debo. Those are the ones got my back. But today we got reinforcements with Dr. Kevin Izzard,
Mm-hmm.
Mr. Bethay,
Yeah.
and we're joined by Mr. Brent Adams. Mr. Adams, welcome to the family. You in now? You in now? Yes, definitely a pleasure.
You
Definitely.
in with the in crowd.
Yes, you're in with the in crowd. Thank you. So we wanted to talk about normalizing, as someone on Facebook said, I mean on YouTube said, normalizing being healthy. We want to normalize being healthy. And some of this is so it's just um having the discussions isn't something that is scary. We want it to be something that is common that you can talk about. And I want to ask you, Brent, a little bit about when your dad was diagnosed. How did that change the conversations that you had? And how did that change your outlook on health in general?
So I guess I'll be honest and just kind of like go with the,
Please.
let you guys know just the situation. My dad being older, so I'm 34, he's 88.
Okay.
So just having that kind of gap, he was already in his 50s when I was born. So when he got the diagnosis, I was in high school. I want to say I was like early in high school. I know I wasn't driving yet because I would go to the chemotherapy with him. I would go with them in the morning. It would be usually before work, or if he was we were at his shop together, we would go over lunch break or something like that.
Okay.
So yeah, I remember he wanted me to kind of be there with him in those moments for sure. But I don't really remember talking too much about it explicitly. Like, this is kind of what I'm going through. I just know we were going to the hospital. It was for the chemo and the prostate, whatnot, but not super detailed. He's not a guy who's super talkative.
Okay.
In that way, he leads with his actions and just being a good dude through and through.
Good.
So but it's like when you do get those opportunities for him to share, it's usually around the kitchen table.
Oh wow. Okay.
He'll kind of just like whisper over. So he'll be looking at the TV, like be a game on or something. But then it'll just like drop, I don't say a bomb, but just like some real good information.
Okay.
Maybe it's like an update on some family or ask about how I'm doing and want me to go into details.
Okay.
Asking kind of the right
Good.
questions or stuff like that.
Good.
So it's like
I just wanted to say I'm thankful that you had the opportunity to go with your dad. I wish someone had chance to go with me. So to go and get the diagnosis by yourself was overwhelming, and to go and have the therapy that I had to have and have nobody with me, it kind of made me angry, because if I had been given to my family like I had, and all of a sudden I'm going through this and no one's there with me, made me kind of angry. But the better part of it is having you there for your dad. For me, makes me think that it was better in his head, because we also have a part of us that needs to be okay up here so that we can be okay down there. So thank you for being there for your dad.
Yeah. And to be in high school going through that, it's something I'm sure you were curious, but it was until he said something, you weren't going to say much about it or ask questions. You just knew you were there.
Yeah, it was like I knew enough that it was beatable.
Okay.
And it didn't seem to be like a terminal diagnosis.
Right.
Okay.
Per se.
Let me ask you that. So at what point did you make the connection that my dad's got cancer? Oh, I'm at higher risk. Did you make that connection?
Oh,
when was it?
Yeah, I guess waiting until it isn't my turn to to start doing the exams or stuff like that. Because I'll say, it starts with my dad, but it's really my family through and through. One of my first cousins, somebody who my dad would for sure consider almost like another son. He's been going through it for some time. I'll mention the guy Mark Sane. I don't know if that's the name anybody recognize. The good brother, he lost his battle. I'll say over the weekend, he was a assistant chief firefighter, put in almost 30 years for the department. So there'll be memorials coming up for him soon. So anybody want to support there.
It's an important thing to do in your case that we should bring out. One is that you said your dad was 48 when he was diagnosed?
I want to say, so it was like probably 60s, mid 60s or something.
Okay. Usually we start screening for prostate cancer if you're an average person at 50. Okay.
Mhm.
If you're at higher risk, meaning that an African American men, we're at higher risk for prostate cancer because we're more likely to get it and we're more likely to get it earlier. And it tends to be more aggressive when we do get it. So we should be getting screened at 45. Now, some organizations like the urologist organization will say we should be screening at 40. But so let's say at 40, black men should be getting screened. If you got a family member who has prostate cancer, let's say that your dad was 48 when he was diagnosed, then we should be getting screened 10 years before that first degree relative. So, if your dad was diagnosed at 48, then we should be starting to get screened at 38. Okay, so yeah, you got to have that conversation with your doctor because some of it also will determine whether, when you're getting screened, you want to make sure you're not getting billed for it.
Right.
So the doctor has to code it as a, as a screening test as opposed to a diagnostic test.
Right.
So yeah, let them know your family history for that reason too.
Yeah, that's really critical. And one of the things you've shared, I mean, and we appreciate you being able to share your story. You participated in an idea lab. What in the world is an idea lab? Tell us from your perspective what that was and what it was like.
Yeah, it was like one of those marketing groups,
Okay.
like marketing research kind of things.
Okay.
And the young lady that put it together, she runs Social X, and they do a lot of good wellness for the men and for the women.
Yeah.
But yeah, when she said like anybody interested in being an ambassador or something like that, I mean, it's something that touched me personally. So it's like I want to share, I want to spread awareness the best way that I can. So the lab, so we had about 10 to 15 good brothers in there. I know Dr. Azar was in there as well. And just thinking about the phrasing, like how do we connect with people to make it where they can act? That's the ultimate thing. We could talk about it all day, but getting them to go in and do the screenings. When there's like a mobile clinic set up or something like that, getting people to just participate. So I know we had a gentleman in the room who hands out flyers. He was saying, if you want me handing out something, this is kind of what it should say. And, just make it easy for people to digest.
Yeah. That's a good segue into to what's going on. So that was part of, there's a group called the Prostate Health Equity Project. And it's a project that's being funded through the medical through Greater Milwaukee Foundation and with partnership. So we're trying to form partnerships with different organizations, and part of that outreach is to try to come up with creative ways to reduce the disparity in prostate cancer deaths. And so and that idea lab was an opportunity to get together with people from the community to say, okay, this is what we're doing. What do you think? What kind of things work? What, with sending mailers out affect you? Is it better to have things on TV? Is it better to have things in person? Is it better to use the churches or a barber shop or, to find creative ways to get the word out that guys should be getting screened? We did have a documentary, showed a documentary at the fatherhood summit this past week. And
the silent killer.
Yep. Yeah. Prostate, the silent killer. And so we're trying to find creative ways to get the word out. You should be getting screened. And in fact, if anybody out there, feels like they have a special calling, they want to help out, we probably have another idea lab. We're looking at maybe December having, or maybe in the spring having another one. I think we're looking at December for our next one. It's gonna be a Thursday night. I think it's December 4th. But anyway, if you're interested in that, you can contact the station and let us know. Just let them know your name, and they'll get that information to us.
Yes, and if you are interested, you can also call 414-955-2364. That's my office number, and I'll make sure that you get connected. Again, that's 414-955-2364. But we also want to hear from you this morning, family. Again, that number to call in is 414-444-5253 or 414-444-5250.
Hey, I got a question for, and I don't want to put you on the spot here, Jermaine. So feel free to pass up if you want to. So now you say how old were you diagnosed when you found you had prostate cancer?
47.
Okay, 47. So were you get a routine screen, or how'd that come about?
No, actually, I was going in. I was having surgery on my ankle, and so they was doing all of the blood work
Uh-huh.
then. So I'm like, just go ahead and do all of the blood work. Let's go ahead and get it done.
Right.
Since y'all poking me anyway,
Uh-huh.
let's just do it.
Right.
And so they did that, and my PSA came back 13.8.
Whoa.
Wow.
Oh,
So
okay.
they was like, hold on, something is
Yeah.
something's happening. But
Yeah.
I had no clue. I just thought, because at that time I had picked up weight, so I used to feel a little pressure, but I thought it was from
Uh-huh.
me picking up the weight.
Yeah.
Mhm.
So when they when they did it, it was like, okay, something is going on. We need you to come back. So I said, okay, and then they went through the process of,
Yeah.
of finding out, and they put me in the tube, and they told me I had a tumor.
Uh-huh.
It was the size of a baseball.
Oh, that big. Wow.
So they went in
Yeah.
with the robot. I got 6 inserts
Uh-huh.
going across when they went in
Uh-huh.
and cut the prostate out.
Yeah. Yeah. So I tell you, that's good.
Mhm.
Fortuitous that you had, someone screen you, because they weren't even looking for it. So just out of curiosity, so before that, because you said go ahead and check everything,
Yeah.
had you known that you should be getting your prostate checked?
Nah.
Yeah.
I mean,
No, someone
because
ever discussed it with you before.
nobody, discussed it with me. Now, I had a cousin. He was 36, 37 when he passed from prostate. But again, in the family, people really don't talk about this type of
That's
stuff.
right. That's
Mhm.
right.
So I went to Indiana to see him. Uh, you know, when he was on his last stages, but
Mm-hmm.
um, he found out he had prostate cancer because he was having back pain,
Oh,
and it was severe. So he couldn't figure out why his back was hurt.
yeah.
Mhm.
So he would go to the hospital, and they would check him out, and they tell him they couldn't find
Right.
nothing wrong, but he was snapping like something is wrong. My
Yeah.
back is hurting,
Right.
and that's when they found out he had stage 4 prostate.
Right. I'm groaning because usually by the time it gets to the bone, it's metastatic.
Yeah.
And the idea, you want to catch it early. You want to catch it when it's still just in the prostate. And so
And metastatic means
metastatic means it's spread.
Yeah.
It's spread, and usually that's a bad sign. So
Yeah, and I mean, this was the crazy thing about me, because when they called me, it was that Wednesday before Christmas.
uh-huh.
The Wednesday before Christmas, and told me that I had prostate cancer. So I'm like, okay. And that same day, I had to play at a funeral. So I'm dealing with that.
Yeah.
So I called my parents, and I told my parents. They was like, "Nah, son, we gonna pray about this thing. You're gonna be all right. Don't worry about it."
Right.
Because I felt myself, going into that stage. Oh man, I mean, I'm thinking about everything at that point in time.
Mhm.
Yeah.
Now, I get dressed. I get to the funeral. Now, this is after I get my mind together. Like, okay, I'm all right.
Yeah.
Mhm.
I'm gonna be okay. I get to the service. I get on the organ. They got the time for the family to come up and speak.
Uh-huh.
The family come up and speak. Guess what he died from?
Oh, don't say it.
Prostate cancer.
Man, no, now I'm on the organ like, oh, oh my God. So now I'm fighting it all over again.
Yes,
Mhm.
yes, yes.
And but one thing I know for sure is if you keep a positive mindset,
Now you see what I was saying.
if you
Mhm.
keep that positive mindset, it will most definitely help you, because as soon as you start doubting and thinking that, hey, it was over with, and then I give up,
Mhm.
it happens.
Right.
I want to tap in on by him saying the number 11. I was saying that I didn't have insurance, and you were telling me some stuff about there's places you can go and
Yeah.
do all that.
Mhm.
Well, when I really started getting tested, I was at 11, and I did find out that everyone's number means different things to everyone,
Right.
because we're all born differently, and the way our body try to stays in
Mhm.
homeostasis state,
Right.
that it does its own compensations. Well, by the time I actually got a chance to get tested for treatment, it was 18. But I had to wait those number of years on my part. I didn't know that there was free services or somewhere
Wow.
I could go. So about time I had number 18 and got to my doctor who was at one of the St. Mary's products, he told me, you really need to get it now. It's time. It's really time.
Yeah.
But I chose the doctor because I needed someone to be 100. I have a whole lot of situations and I like to be straight the best I can. And I want you to be straight to me.
Right.
But after I got the diagnosis, I know that I needed something a little softer. As he was saying, it just messes with your brain.
Yeah.
And I wanted to go to someone who was a little bit more soft. So I went to a female cancer doctor and she kind of walked me to it. But I want to say this before we get to the next part. One of the things I asked her, because they said they wanted to do the cancer, I asked her straight out. I said, well, girl, will I be able to have sex after this? And she says, do you want to have sex or do you want to live?
Well, you know what? That's crazy that you said it, because my doctor told me that when they went in with the robots that they was able to spare the nerves around it.
Right.
So, because that was my first question, like, hey, Jack, listen here, man. No, hey, man, what we gonna do about this?
Right.
So he was like, well, we'll go in with the robot, and we'll go around it so the nerves and stuff like that it'll be spared.
Right.
So I was like, whew, okay.
Yeah.
Thank you, Jesus.
Yeah. Somebody depends on where the cancer is in the prostate.
Yeah. But I'm gonna tell you this: when they told me that I had it, and this is right hand to God, I started hearing in my spirit, be careful who you share it with.
Yeah.
Be careful who you share
your body with.
No.
Well, that too.
Real and back
share your diagnosis.
Yeah, can you tell that you got cancer? Yes.
And so I'm like, okay, I'm only going to share it with people that I know is going to pray for me, and you know, that whole thing.
Right.
And when I went through it, I kept it to myself. Went through the surgery April 14th, 2 years ago. After I had the surgery, I was at a music store, and I was talking with one of the guys that work at the music store, and he was like, man, I heard about what happened, man. It's all over the city about what happened to you. And I'm like, yeah. And he looked at me and said, man, it was nice knowing you. And I stopped and I said, what? I said, hold on, brother. I don't have cancer anymore.
Right.
I'm cancer free.
Yeah.
So he kind of smiled, but I wasn't smiling because then it hit me.
Yeah.
I told you, be careful who you share it with. Because if you would have shared it at that time when you was going through the process, it would have caused you to doubt.
Right.
It would have brought that spirit back on you.
Right.
It's over with.
Yeah. And you know what? And we it's something we can't measure, but people's attitude about any kind of health issue affects their ability to either recover from it or survive it. And so if you got a bad attitude, you think you're gonna die, chances are you are gonna die, you know. And so you gotta have a positive attitude, and people are gonna be telling you, oh man, you my dad died, you're gonna die. That's not gonna be helpful.
Exactly.
Exactly. And so
you gotta make sure you got that solid circle.
Right.
And that you have that will to live, man.
Right.
I mean, having that will to live is real.
Right.
So that's like, if you're in a situation that your life is on the line, you're gonna find that will somewhere to make it up out that situation.
Right.
And it's the same way that we're dealing with that.
But in the old days, they didn't look at the spiritual part or whatever part we're speaking about.
Exactly.
They didn't have any faith in it. And sometime when someone did have it and they came out on the other side much better, they say, well, we don't really know what happened. We really don't know what happened. But now the doctors, I should say, and the health practitioners are a little bit more conscious on helping us understand that it is something to do with our mind as well as our body. But before, they didn't talk about prayer or getting yourself in a peaceful place.
Right. And you know what? Before I'm going to be leaving after the break, but some of the ideas I'm going to leave you with, and this something that came up right now in this conversation, is find somebody who you trust. For when you go into that, we have that first meeting with the oncologist, with the urologist. Bring a family member if you got one who can help you, because a lot of times they say cancer and you don't hear anything else after that. Big. So, get someone who's gonna keep notes, and so you talk about your options. You can always get a
Mhm.
second opinion. This is an
Right.
area that's very still a lot of confusion about how we should be treating this. Again, we tend to have more aggressive form of cancer, so we probably should be more aggressive with treating our
With
prostate cancer.
Yeah.
So, but you might opt to observe it, and just now, Jay. I'm glad that you did okay because you don't want to sit on a diagnosis of prostate cancer for years because you don't have insurance.
Jeez.
Well, he did 2 biopsies. The
Uh-huh.
first part of it was 75% found in the biopsy,
Yeah.
and the other part he found 50%. So they just wanted to make sure that it wasn't metastasized someplace else
Right,
because
right.
of the greatness.
Yeah. And so
Yeah.
and by the way, for those who are listening, usually the cutoff for a normal is 4. It shouldn't be below 4. Now, so and we get concerned when it's above 9. So so if you're 11, that's concerning. It's really concerning.
Definitely.
And then that 4 also depends. That's like for screening for someone 50. If you're 35 years old and your PSA is 4, that's different. It shouldn't be that. It shouldn't be 4 at that young age. But your PSA can be elevated because you have a large prostate.
Mhm.
It can be infected. It can be an infection. It can be any number of things can elevate that PSA. So usually we repeat it first as the first step. But yeah, have a conversation because it's a very complicated thing, and the treatments, they're very complicated. Whether you're gonna get your prostate removed, whether you're gonna do the radiation, whether you're gonna do the seeds. And some of those decisions were gonna affect what happens later. So if you do radiation, you actually have cut off your chance of doing surgery later on.
Yeah.
It's a conversation you have to have. Bring a loved one with you because you have to have a conversation with somebody.
So can I ask you this real quick? Because I know we got to go to break. But why is it that if you do the radiation, you can't have the surgery?
Because now everything is like you talking about trying to spare those nerves. Where everything with radiation, it destroys everything in the area. So everything is scarred down now. So you can't go in and take the cancer out because your prostate now is scarred to everything around it.
So you pretty much just stuck.
Yeah. But I mean, there's other things you can do.
Yeah.
You can do hormonal therapy,
Mhm.
and hormonal therapy. So basically, you're talking about destroying your testosterone, and so there's a lot of
So
consequences.
you might
of
as
that.
well go ahead and just have the surgery.
Yeah,
It
but
it's-
there's a
it
risk
depends.
though. But
there's still a
when you do the
risk.
surgery, there's a risk for you can have erectile dysfunction. That's a big one. You can have bladder incontinence, so you got to wear a diaper. You can have stool incontinence. So all those things happen with the surgery that you don't get with the radiation.
You got designer
But
joints.
if it does come back,
Designer,
Yeah.
Louis Vuitton.
yeah.
But that's the thing. It's having that conversation and having that family member to be with you to have that conversation so that you hear everything.
And you know what? It's because when they told me, and I'm sitting in the office, and the doctor walked out, the nurse that was in there said to me, "Hey, I'm gonna be honest with you. Don't have the radiation. Have the surgery.
Mhm.
Get the surgery. Get it over with. Don't go because if you have the radiation, it's pretty much like they poking at you. They poking
Mhm.
around it.
Mhm.
Don't do that. And because I'm thinking, like, man, you had a surgery, it's over with. Man, I was like, I'm young. And what I'm gonna do?
Right.
But he was like, man, don't worry about that.
He got that.
Just
Mhm.
do the surgery, and everything else will fall in place. And he walked out the room.
But I was afraid to have the surgery because of them saying when you have cancer and you open it up, supposedly
it'll
cancer
spread.
goes
And I had
all
asked
over.
my doctor
So
that.
that was the
Yes.
reason.
I asked my
That was the
doctor,
reason why I chose what I did.
That is
now
not a
all
fact.
of the other,
We're
other stuff,
myth-busting. Yep.
Yep.
all
It's
the other stuff that you were talking about, and we were laughing.
Yeah.
It is true though.
It
The incontinence
Yeah.
and stuff,
Mhm.
and wearing the pad, the diaper.
Yeah.
It is really true.
Because
I don't have
happen.
a problem. I don't have a problem sharing that because I think men need to know.
Yeah.
Mhm.
I have a perfect life afterwards.
Yeah.
And if I didn't stop having sex, it would be none for the rest of y'all young men to have it.
Okay, we're gonna go on break. As
I'm on the road.
Family show people.
When the FCC
Look,
gets to us.
Thank you. Look, we're gonna go to on a really good break. I want to thank Dr. Izzard for taking us down this dark tunnel.
Keeping it real.
Keeping it real. Thank you, family. We want to hear from you on the other side. Look, if any pastors out there want to come on and pray for us. But no, we want to hear from you on the other side, family. We're going to take a quick break. Dr. Izzard, we want to thank you for being here.
Welcome.
Thank you so very
But the
much.
conversation continues.
Yes.
It continues. We'll see you on the other side, fam. back, and we want to hear from you. Welcome to Your Health and You, and Your Health and You is not Your Health and You without you calling us in. That phone number is 414-444-5253 and 414-444-5250. Offline, we were talking a little bit about having these conversations and getting more Black men together to have these conversations. And Brent, you're part of Social X. You mentioned Marquela's working with the Idea Lab. Is that a setting where we could possibly collaborate and have those conversations? What does Social X do to make that happen?
Yeah, I think that'd be a great place to start. So Social X, I think, was initially started around the idea of ending the brain drain, right? Kids, raised here, go to college here, and then move on to, cities elsewhere just because there isn't enough going on to keep them entertained and just enough of the right circles for them to interact with. So it's like a professional networking group, but then they have a strong kind of mental health, social health awareness tilt to it. So there's a mental wellness program they do. There's usually a quarterly event. There was one 2 weeks back where we had a guy in talking about conflict resolution. Conflict resolution, whether it's with your, family, work situations, just how to communicate, speak up for yourself and not overtake people at the same time. So that was an avenue we were just, talking about from that aspect. There's a big conference they do usually in the winter where it's a full day thing. They have 4 different speakers come in to talk about different stuff. I know that's actually where I met
Ambrose.
Ambrose. So my wife knows him from working at MCW as well, but that was the first time I really got to talk to him because he did a session on breathing and meditation and stuff like that. So it's like they hit all the different areas to kind of build a complete human.
Awesome. Yeah. So that's part of what we look for are opportunities to be able to have these conversations. And I think our role from the medical college side, we like to convene and then let the community move as the community moves. And one of the things I think of Mr. Andre Lee Ellis and the 500 Tuxedos event that he holds, where it's Black men and young men coming together, young boys coming together, and opportunities that he's offered us to be able to come in and have that conversation. But we were talking also offline a little bit about why we do these secrets. And I mentioned my mama's thing was a child stays in a child's place. And so a lot of stuff that was going on, I did not know about because their perspective was to keep me in a child's place. And I think that part of what we think about is protecting the child so that they can grow up without all of the negativity or the worrying. But for you, Brent, your dad actually brought you with him when you were 15 or in high school. So you kind of got to walk that walk and be close to him while he was going through that. And that having that conversation. And that's one of the things I think, and correct me if I'm wrong, because not being a Black man, I can't speak from that perspective, but part of what we see is that there's, we don't want people to worry. And Jermaine shared that, you don't want, kids are going off to college. You don't want, this is not something we want them worrying about when they have their whole lives in front of them. So having those conversations with your dad, I'm sure kind of eye-opening, but also can be somewhat scary at the same time.
Yeah. I guess he always just raised me to, be a good, strong man. So it was like the little things when he would have me over to cut the grass, clean out the gutters, stuff. Just him teaching me how to be a man about it, just like take care of the house and certain things. Cooking is a big thing that we shared. So when I would realize he was like trying to share certain recipes with me or be like, can you make the beans and then just tell me exactly how it goes? And he was just always trying to share and instill certain values, certain wisdom in me, I feel like. And that was just part of it.
That's awesome.
It's like just something we can't shy away from. You gotta just know when you come across it yourself, how to take it.
Yeah.
I would like to tap back into who you tell and how it's told. We always talk about having a family member with you. Well, I'm a guy who not only love children, is that children are a very, very active part of who I am. And so I had to tell a 7-year-old that I had prostate cancer before he got the C word from everybody else. And the family thinks about C word as dying.
Yeah, no.
So I had the 7-year-old and I wanted to tell him. And so I said, can I call his name?
It's up to you.
Yeah. I said, Johari, I said, I want to tell you something about Paw. He's not really doing well. And he said, what is it? I said, well, I'm sick. And I said, when you're sick, what do you do? And he says, you go to the doctor. And I said, okay, well, now that you're sick and you go to the doctor, what does the doctor do? He gives you some pills. And so I kept adding a little bit at a time. And I said, so when you get the pills and you take the pills and you don't get well, then what? He said, well, you probably have to take some more pills. So I said, okay, now you went to and I just took him all the way back. I said, now that you've taken the pills the second time and now they still don't work, what do you do? He says, I guess you die. And I said, what? He says, I guess you go back in that little box. I took him at 4 years old to a funeral, and there was a lady in the box, and that's how he was able to relate to being in the box for death. But I told him, I said, if that happens, and I don't know if it is, but the one thing I want you to know is not only don't worry, but as long as you love your pawpaw, you've done all you can do. So I had to reach him at his age with his understanding. So to tell someone, it's really important that you tell them where they are in their head so they can get a good understanding, because other than that, the big word C for a lot of people just means death.
And that's part of why we do this program and why we have the health griots and people like Brent on to so that you can see getting the diagnosis isn't the end. It's the beginning of starting a new stage in life and about how you continue to live. There's going to be changes. There's going to be things that change. But as you were joking before, you know, you do the treatment or you die. And the one piece that we try to get people to understand through this program and programs we do in the community is that prevention is the key. We had talked a little bit before when Dr. Isser was here, a little bit about stages and 9 times out of 10. So the thing is, 70% of Black men have are more likely to be diagnosed and 2 times as likely to pass away because they are likely to be diagnosed at later stages. And with cancer, the sooner the diagnosis, the better. The sooner we diagnose it, the better. Dr. Isser talked about, and I always have trouble with this word, so forgive me, family, metastasizes, or it spreads. And if it spreads, it's harder to treat. But if it's what we call localized, or if it's just at one area, it's easier for us to treat it. We can treat it a whole lot easier that way. So earlier diagnosis means we're able to locate it when it's at stage 0, stage 1, something that's a lot easier to do. So it's one of those things that we're nervous about getting we're nervous about going to the doctor. We're nervous about getting the diagnosis. But we have to begin by having the conversation. And that's why I think one of the things that Social X does so well is to sit down and have that conversation. And I think to me, Social X started with the hardest conversation of normalizing self-care and mental health. And if you can talk about that, you can talk about anything. And I know that there's one track that they often do with men. There's a track that they do with women, and then combined often. So those things, when you can have those hard conversations and you can pull a group together like Social X does, we're not just talking about 10, 15, 20. We're talking about a room full.
Yeah, that one, it was I think a Wednesday night. I walked in kind of right when it was gonna start, and the room was full already. And I was like, oh man, I guess I gotta walk to the back to get me a spot. But yeah, I'll shout out Renell Washington. He's the one that does the men's events. And yeah, I'm not sure the next one coming up, but I know we would love to have you guys and kind of, because it's, you know, they have people as young as early 20s, but all the way up to, I would say, late 40s, 50s. So
Yeah.
guys that are, you know, it's time
Yeah.
to start doing those screenings and getting in position.
Yeah. And I think Renell and Marquela do an excellent job of just talking about it and putting it right there with experts that can help walk you through it. Normalizing. I know Ambrose, who is probably listening. Shout out to Ambrose, our program coordinator over Men's Health for the Cancer Center outreach and engagement. He has normalized us to do breath work, to pay attention to your breath, to use your breath to calm down and to remove anxieties. And that's one of the things, again, when we look at Black men, when you look at some of the concerns and the key challenges, socioeconomic barriers, and access to care and trust. And then there's this cultural stigma around mental health. And that cultural stigma, I think, a big shout out to Renell and Marquela for making it a normal conversation around the table. I mean, and that's we want to do the same thing around prostate health during the month of November and beyond.
Well, one thing for me that I've learned now, and I've been passing on to the people that I have the opportunity to speak with, is 1 + 1 = 2. One change in your physical exam is the blood test, the PSA. One change in your knowledge base and a start to better health outcomes equals to take control of your prostate health and live a better, longer life. Wow. So it's 1 + 1 = 2. Very simple to remember. It's change, chance, control. Thank you.
Mm-hmm. So you take one change, prevention.
Right.
One chance.
Right.
To learn more.
Right. To take control.
To take control. And that's the thing. We are here to give you information so that when you walk into your doctor's office, you walk with knowledge.
That's right.
Most importantly, you walk with knowing what questions you should ask. And one of the things that we have to step back and know, if your son or daughter is walking into the doctor's office and they're not armed with everything that they need, such as their family health history, it's like a disservice, because they're walking in blindly. You're not giving the doc enough information. You're not getting your loved one enough information. Mm-hmm. So being able to talk about it is what's really, really key. I wanted to, Brent, go back to what are things that you think we can do to hold each other accountable for the screenings? What do you think what we can do?
Good question. So, I mean, personally, I've been taking it on myself to just talk about it to people more. I guess I'm realizing somewhat not super outspoken, but I'm starting to see that I need to speak up about certain things to certain people, just to try to help them out, I guess, and just like make the world a better place in general, hopefully. But like I'll say, one thing I did a few years back after having my second kid, I got a vasectomy. Not something that a lot of people want to talk about. You know, when you hear about that, I didn't have any questions about like, will I still be able to have sex or different stuff like that? But you maybe wonder, like, will it be different? What exactly might change there? But I wasn't worried about it. I knew it was a good health decision for me personally, right? And not, you know, trying to cap it at the 2 beautiful kids that I do have, right? Just being responsible to myself and other people. So I went on, was like a little tour where I was telling a lot of people that I did it. So that was something kind of back then. And then now I've been telling, you know, sharing the word, sharing the gospel with more people, things like that. So like prostate health, this is kind of the next thing. My sisters, they're very involved in hereditary cancer. They have a nonprofit going on with it. Their mom unfortunately passed from it, but they did everything they could to make sure it doesn't happen to them. They went through all the genetic testing and stuff like that. My wife also went through genetic testing, and she does have a higher chance of getting breast cancer. So just, you know, staying ahead of it, trying to do everything you can to just be aware. So, you know, when you mentioned Right, the knowledge and the it gets you control, having the control of the situation where you at least have options to where it's like, do I want to do radiation? Do I want to do the surgery? At least you have an option to where maybe somebody might be at stage 4 because they never even wanted to look at it or never wanted to, or they passed and we're not even sure what had happened from until we do the autopsy or something like that. So just having the knowledge.
It's about giving it that chance. And your aunt's beautiful. I love them. One happens to be my soror, but I love them still. I love all of them. But we did a collaborative program with them around their organizations, Families Fighting Hereditary Cancer. And they really are advocating as being a previver. And I think even if you get your screenings, you're being a previver. If you get the genetic testing, you're even more into being a previver. Right. And so the genetic testing is something it's difficult to get if you don't have that family history. And so if you have that family health history, it's easier for your doctor to say, yes, this is medically necessary because of the family history.
I'm a simple kind of guy. Would you please break down that pre-survivor?
Yeah. So previver.
Yeah, that's it.
Yes, if I quote them right. Previver means that I'm taking steps ahead of time, finding out. So like if you do the genetic testing, you find out that you have the BRCA gene, the gene that makes you higher risk for breast cancer. And then you have that conversation before you're actually diagnosed with cancer with your doctor about what are my options, what should I do. Previvers often will say, like you remember Angelina Jolie. Okay. She is that the right name? She actually had double mastectomy. She had both of her breasts removed once she found out that she had that gene. So she is a previver because she indeed had the gene for breast cancer and did things ahead of time so that she wouldn't have to go through the actual diagnosis.
So before she had the cancer,
yes,
to be a survivor,
yes,
she went and did what she needed to do before. So that's the pre.
That's the pre.
So she did what she needed to do before she even had the diagnosis.
Yes.
Previver.
Yes.
Okay. All right.
And and that it's the thing, you have to have the conversation with your doctor of, I have this family history and therefore I need to I have this family history, therefore I really want to get genetic testing. And your doctor will ask a bunch of questions. Who was it? And like in the case of your aunts are very open about it. It's their mom and then both sisters. And that's a reason why you go ahead to have it. So being armed with that knowledge and that information is so critical so that your doctor has the information to be able to move forward.
I would like to ask you one question that Brent brought up. I hope you don't mind. Do you think that a conversation should be probably talked about the vasectomy, not on this particular platform, but because we have young men that are farmers, they planting seeds all over the world instead of just in one plot. And I was thinking maybe that would be something. I mean, we're talking about secret. So I have grandkids who got a daddy over here and a daddy over here and a daddy over here, and there's nowhere in the world they can really find out what's going on. But if that daddy would have had the vasectomy, maybe he wouldn't have been a farmer that was farming a daddy over here and another child over here and another child over there.
I'm a strong believer, and Brent, please jump in, that you have to be armed with the information. And then that's a personal choice. Anything that you do with your health is a personal choice. But I think oftentimes we don't think about, sometimes we don't think about the cause and effect. What will happen if.
Yeah, but that's my legacy. That's my legacy.
Yeah,
if I go over and have this baby over here and this baby over here, that's my legacy.
Yeah.
But the legacy is you ain't taking care of it and it's over there being taken care of by Joe.
And that is a whole nother show.
That's what I said, a whole nother show.
Yeah. But it's one of those things where you have to have the information. You have to have the information. One of the things I looked at, I was like, okay, I have 2 daughters.
Okay.
four bonus sons. So I have six children total.
Okay.
When I started thinking about and when I married my husband, he had the four boys, and they were like all looking at college at the same time. And I was like, we ain't never gonna stop working. So we gotta continue working. And that's part of the cost of things nowadays. That to me is the deterrent when we really look at it. It's hard, but we're gonna come back on the other side. We're gonna take a quick break, family. We're gonna continue talking about this, and please feel free to join the conversation. 414-444-5250, 414-444-5253, and we'll see you on the other side. Back, family, welcome back. And we want to hear from you. You all have been quiet today. That's unusual. Putting that out there.
Maybe because we've been talking so
Maybe
much
because
and
we've
they
been
got
talking.
the answers.
I hope so. I hope so. The number you can call if you do have questions or you do want to just join in the conversation, give your perspective, and is 414-444-5253 or 414-444-5250. We're joined today by Mr. Bethay. He is a prostate cancer thriver.
Yes,
Thriver.
yes.
And Mr. Brent Adams, who walked with his dad as he went through his prostate cancer journey. One of the things I think we've touched on a lot today.
Yes.
I have notes for about 6 other shows, so we're gonna have to get this together. But I think the health griots, Mr. Bethay, you are part of the health griots.
Yes, I am.
And this is a group of African American men who are all prostate cancer survivors.
Yes.
And I will tell you, they all are very outspoken advocates for themselves and others. So tell me a little bit about your experience with the health griots.
Well, I can say that we have built a very close brotherhood, which is something that's a little strange in its way because it's not a fraternity and it's not one of those other kind of organizations that you say you get a brotherhood, but ours just happens to be one because we're men of faith, and I think some of the reasons why we are, although we have other reasons, is that the prostate cancer itself, the journey itself, had to have us reach into a higher power. And most of the men that's in the group, including myself, we're deacons.
Mm.
And so that helps in one way. So that has joined a brotherhood. We all come from, of course, different aspects of life and with our jobs as well. But it just mashed so well together.
Mhm.
We look forward to being together just to go and tell what we did when we were not together.
Mhm.
And the last thing I want to say about that is before we discharge ourselves and go home, we do say a prayer to our higher power. Because we have different faiths there, we do not try to hurt anyone's feeling. And if you do not want to pray, brother, you can walk out the door
Mhm.
because we are. And that's exactly what I say. But most of us stay there. But it's
Awesome.
rarely, really worthwhile being a griot. And I am very proud that I was chosen to be one.
We are proud to have you. Proud to have you. And we do have a caller on the line. Caller, thank you so much for joining your Health and You. Go right ahead.
Yes, I've had prostate cancer for some years now. I'm up to about 82.
Okay.
And the way they stand now, that you can stop the treatments and stuff because I taken a neutron shot. And I don't know what at the time when they give me the neutron shot, but I have a pastor in Dallas, Texas. He prays for a lot of men that had prostate cancer, and they all clear of it. This man is a really praying man. His grandson had autism,
Mm-hmm.
born with it, and now at the age of 7, he don't have it no more.
Mm.
But I didn't tell him the whole thing when I asked him to pay for my prostate. But I don't know why the neutron shot would hold up things. But anyway, my son was looking on the computer, and he told me, he said, there was a guy on the computer. He had prostate, and he started using Vicks, vapor rub on his prostate, and now he's clear of prostate. So, but my best friend, son, just died this year. He was a friend. He went to Palau, and he was a friend of the chief of police in Milwaukee.
Mm-hmm.
But he died at 50 something.
Mm-hmm.
But he went out and he tried to do a lot of things to help himself. And a lot of these things they be selling out there don't work too good. So mine's pretty well under control.
Mhm.
This is why my doctor told me that I don't have to go back to kids, but I just don't believe in that.
Mm.
I'm not gonna stop with that.
All right. Thank you, Will. God bless that you are well.
Yes,
The neutron, and thank you for your call, caller. We appreciate you. Thank you.
Yes.
The neutron shot that he refers to is actually a part of what we refer to as precision medicine, and it's a precise way to target the cancer with radiation, and it does. It's what we call targeted therapy to destroy the cancerous cells. And again, depending upon when your cancer is caught, determines if a treatment such as that is what is best. Um, and we've talked a little bit about, and we could also talk a little bit about treatments. That's something else we can bring to you, family, is talking about what the different treatments are. I know we've touched on it before, but we've heard about chemotherapy, radiation, the surgery, specifically when you're looking at prostate cancer. Understand that what is best for you is best for you. What is best for what your cousin did when he had prostate cancer was what was best for him. All of our bodies are different. And that's part of the reason why we do at the medical college, we're really blessed to have the doctors and the equipment to be able to do precision medicine.
That's right.
And we just built this brand new, beautiful Center for Cancer Discovery, a huge building, which also helps promote the researchers being able to talk to one another and try to do better with the research that comes up. But I think one of the things to understand the treatment that the gentleman spoke to, and thank you so much for bringing this up, brings us around to that targeted therapies. The other therapy that they also use to treat cancer is immunotherapy. And I always say that wrong. Immunotherapy, where they use your own immune system to fight off the cancer. And the advances with that are incredible for difficult cancers such as multiple myeloma, um, which are hard to diagnose and also difficult to treat. Things like immunotherapy is one that helps to target your immune system to, or ramp up your immune system to fight the cancer a lot better. So again, the biggest thing is being diagnosed early and finding it early. So your Mr. Bethay's equation for making one change and getting testing, doing the prevention, that one chance to give it an opportunity equals 2, which is 2
Take charge.
to take charge, to take charge of your health. That's really, really important. Family, continue to call in if you like, 414-444-5253. We have just a few more minutes with our guest here today, and also want to hear from you on other topics that we should probably talk about. I'm gonna ask you both, what message do you think you would like to leave with brothers and fathers today? What message do you think is so key? Brent, we'll start with you.
I guess health is wealth.
Mm.
You know, to take care of your body, take care of your mind. You know, you only get one opportunity here, so got to make the best of it, make the most of it.
Mm-hmm. So just as important as we feel, as I'm going, my kids, if they're listening, they're going to kill me. But we believe in stacking those coins. You want to stack those coins of health through the prevention movement. So health is wealth. I love it. That's perfect.
Yeah, like compound interest.
Yes.
You
Yes,
know,
he is a
the health
financial
compounds over time.
Yes.
For sure. I mean, just think about being overweight, stuff like that, how it just may wear on your joints. And when you mentioned the farmers out there spreading the seeds, that's a mental health issue.
Yeah.
It's the reason that they feel like they have to do that. You know, it's if they could more so come to grips with who they are and what their purpose is in this world, I'm sure they'd be moving a whole lot different.
Yeah. Yeah.
So,
and it's so important. I think one thing that you is talking about that being present for moments like this. it's difficult to be present when you are distracted or have so much on you. Um, so important to understand that health includes not only your physical health, but also most importantly, your mental health, which it's wealth. And Mr. Bethay, what's your message?
Well, what I've learned through this journey of prostate cancer is that sex is not, and I do this on purpose, sex is not just manhood or masculinity. It is for you to really be more attentive to your partner and their needs
Mm-hmm.
because they're in this with you. And because they're in there with you, you need to forget the me, because sometime, as I said, for me personally, when you were there before, you were there in a whole different state than where you would be now after you come through the prostate cancer. So to be meaningful with your partner and their concerns,
Mm-hmm.
more than just focusing in on what you used to do and how you used to do it.
Mm-hmm. And the communication is so
okay.
key.
Yeah, you got to talk to them. You know, they need like to
That
be
is
hugged.
not what
They
I
like
was
to be
leading
hugged and all
towards,
that
Lord
stuff. Okay.
Father.
Okay.
Is communication. So one of the things Dr. Izzard have mentioned, I have to, y'all just pray for me. Just pray for me. That one of the things Dr. Izzard mentioned was the hormone therapy. And I've known men who have gone through the prostate cancer treatment, had hormone therapy, and then went through mood swings. Yeah, hot flashes, mood swings, the whole 9 yards. Yes, and they don't say anything. I had a friend whose husband was going through, and he did not mention anything about it. And look, it make you ready to pack. It was like
second pew in church, second pew in church, like the woman that they call on the corner. I'm telling you, it was that bad.
It's hot. And so if you don't talk about it and talk about your ramifications of what you're feeling and what you're going through, you've got to talk about it, because as a woman, I've gone through hot flashes. I know what it's like. It's horrible, and I can't even, if my husband had to go through hot flashes, we would never have the heat on in the house. Right now, he wants to turn the heat on every single time, but he doesn't. I'm like, I don't want cover. I just, it's hot. And if you don't talk to your partner, don't have these conversations about, this is what the medication is doing. This is the treatment I'm on right now. And being able to have that communication with your doctor to say, this is more than I can handle.
Yeah. I did find out that they have that little thing that the women wear, but us men can't wear it. No, it's for women. They have a little device that women can wear that's supposed to help with the hot flashes, but it is definitely only for females.
It's for females.
Yeah.
Okay. Thanks for that. That's tidbit of information.
But I had to look into it. I'm the one who.
Yeah, you got to. Okay. You got to. I appreciate you. Caller, we see you on the line. Welcome to Your Health and You. How can we help you today? Or what can you help us with? Yes.
Can you hear me?
Yes, sir.
Yes. I timed in a little late, but I had heard the last gentleman talk about one of the procedures. Then I heard you also say how it's body specific. Because I have a cousin that has his prostate moved, and I just thought that maybe that might be the only alternative. My doctor said that I could either do the radiation or the removal of the prostate. You had mentioned that there's more options, though, as well, if you catch the time. Could you elaborate a little bit more on that?
Sure. Thank you. And thank you for that question. I appreciate it. The treatment options depend upon where you are with your diagnosis. So whatever stage you're at. It also depends upon where the cancer is located. So that's part of what we talked about. If the doctor says that we can do radiation, understand that targets a larger area than the surgery, which can be very, very specific, which Mr. Jermaine talked about. They were able to remove his tumor that he had that was the size of a softball or baseball. they were able to remove it without any damage to the surrounding nerves, which is something that men get concerned about. And then there also, as Brent's dad went through chemotherapy, that's another type of treatment. So if you are at the stage where you've been diagnosed and you're questioning that the doctor only gave you the option of surgery, you can go back and make that phone call and ask the question, why is surgery is surgery my only option, or is surgery the best option?
Yes.
Yeah. So that's the question you want to ask. The other thing that I tell people all the time, you can always get a second opinion. If you feel that you're not getting all of the information, um, if you don't feel comfortable with whatever, the conversation between you and that doctor, you can always get a second opinion. But the number one question is, you go back to your doctor and say, you said that my option was surgery. Is that my only option? And if so, why? You have the right to ask those questions. It's not, the doctor will not be frustrated that you are asking questions and not just doing. No,
he shouldn't be.
he shouldn't be frustrated with that. The doctor should be open to the fact that you want to be a partner in your treatment. So there are many different ways to treat it. It depends upon a lot of different factors. So yeah.
Yeah, because I never thought of just having the tumors removed. That is an option also if it's caught early enough.
Yeah, if the doctor can identify specifically where the tumors are, and can for sure say that it hasn't spread. So often if they say, we're going to remove it, then it might be that the cancer is what we call localized. It's only in the prostate. And if we just remove that, and how many tumors too. Thank you, Mr. Bethea. It also determines the number. So if they're saying we can just remove the prostate or we can do the surgery, it might be that it's easy enough to look to see it and get it. But I strongly suggest that you have that conversation. Call your doctor and say, you said that my option was was surgery. Why is that my only option? And they should be able to have that conversation with you without them feeling uncomfortable or you feeling uncomfortable. A lot of the doctors I work with, they like to have that. Oh, you want to know more? And I can tell you, there's one breast surgeon that I work with, and she will sit down with a pad of paper and will draw pictures and write it out for you. And you take that pad with you when you leave. She will, tell you all of what your diagnosis is, what the treatment possibly can be, and then what the treatment is that she recommends and why. So, and she enjoys having that conversation. She's phenomenal, but it's the desire to understand your diagnosis and your treatment options. That's what's most important and key.
Right. Okay.
Awesome.
Yeah. Well, just I don't know if you can determine this or not, but I'm kind of quoting offhand, but the right side has more polyps than the left side, because he was saying that he can save my left side, and he'd have to remove some of the nerve on the right side.
Mm-hmm.
But would that cancel out trying just to remove the tumors? Are you aware of that, or can you?
Yeah, I would not know. That is a question. I mean, do not be afraid or nervous to ask more questions. They went to school for a reason. They
and they're getting paid for a reason.
They're getting paid for a reason, yes. And so what's key is that you ask questions until you are in a space where you feel comfortable with your final decision and feel that you've gotten all of the information that you need. And he should not, he or she, whoever your doctor is, should not feel like you're challenging them, but it's more you want to be informed. And when we treat I'm not a doctor. So when you go into that doctor's office, you are the focus. You are the focal point. And patient-centered care is what should be the primary focus when that doctor walks into that room. So if you walk out and you don't have all your answers, that there's a problem. So you need to
Right.
definitely make that phone
Yeah,
call.
I was talking about some comorbidity, some other stuff that he
All right.
be having going on.
Yeah, and there may be other reasons why they chose surgery. So it's just, I mean, if he says because you're high blood pressure or because of weight factors, also they will check your heart. There's a lot of different pieces that are in play with regards to making that decision. So it's not something I can speak to, but it is something that your doctor can definitely give you more information.
Okay. One last question, if you don't mind. He said that the medical college has some information and some technology that I might be able to use. How could I get in touch with someone on that end, just in case?
So I'm going to ask you to call me at 414.
Hold on 1 second.
You're good.
Okay, 414
955
955.
2364.
Okay.
And I can connect you to those resources.
Okay. Thank you very much.
Thank you so much, caller. I appreciate you. Thank you. And I look forward to speaking to you. So we're about to wrap up. I want to thank our family for being in the room and conversing with us. I also want to thank Jermaine for your openness and willingness to share your story. It makes a difference. It makes a difference. Mr. Adams, Brent, thank you for sharing your story and the story of your dad and walking with him through his journey. And as always, Brother Bethay, definitely want to appreciate you and thank you. Family, we want you to know, talk early, talk often. Conversations save lives. Get screened. Prevention and awareness matters. Connect to your community. Resources like Health Griots and Prostate Health Equity Project also exist only with you. We want to thank you today. We'll see you in 2 weeks. Also, we want to tell you I will be, and I hope to see you there. So if you have more questions, you can come on November 12th from 7 a.m. until noon. Come over by my office. This is where I'm located at Thrive on King. WNOV is hitting the road. You can see your regular weekday morning guest or host that you always like to see, Miss Michelle Bryant and Mr. Keith Paris. They will be there live. I will be there. Our griots will be there. This is on November 12th from 7 until noon. 7 until noon. Also, the shows that'll be on. This is so helpful. Y'all just think of me. In the morning from 7 to 9, we're going to talk about crime and community wellness with Michelle Bryant. Spiritual and financial wellness is from 9 to 11 with Mr. Keith Paris. And grief and healing by Dr. Kwaku. And they have some awesome guests lined up. You can talk to Danita Ball from 7 to 9 with Michelle. Pastor Kenneth Locke is one that's going to be on from 9 to 11. And other special guests that'll be joining Dr. Kwaku, including Tiffany Terry. I'm only giving you a couple names, but there are tons that'll be there. It is free, but you must register. So you can call the station or you can go to the website. Make sure that you register. There will be food and giveaway items. I'm not giving away too much more, but make sure you're there. We want to see you. And I want to see you come and talk to me. I want to thank you from Your Health and You. Thank you for my supporters, Mr. Jermaine and Mr. Debo. Appreciate you all immensely. And we'll see you on the other side.